Hi, I'm Shantha Rajaratnam. I'm a Professor of Sleep and Circadian Medicine at Monash University. I'm the Director of Engagement and Translation at the Turner Institute for Brain and Mental Health. The Turner Institute for Brain and Mental Health is committed to improving the mental health of the nation. We recognise that mental health problems in the community are rapidly escalating. We know that particularly in certain workforces, the problems are more intense. We are committed to taking state-of-the-art research-based solutions into these occupational settings and these community settings to ultimately improve the mental health and brain health of the nation.
Shantha, thanks for joining us, particularly the Turner Institute as a supporting partner of CCF in addressing the challenges associated with mental health and well-being. There's obviously a need for prevention-focused initiatives and evidence-based sleep health programs to mitigate the substantial health and productivity needs, particularly within the construction industry. Can you provide us an overview of the relationship between fatigue, sleep, physical and psychosocial health?
Thanks, John. Yeah, it's a great pleasure for us to work with with CCF and the construction industry more broadly as well. It is really consistent with the Turner Institute's mission of improving mental health in the community, particularly in populations that are vulnerable to mental health problems. We were approached a few years ago by the construction industry to start to think about new ways in which the escalating mental health problems could be tackled. The Turner Institute has a focus on preventative programs, and my area of work in the area of sleep and circadian rhythms was identified as a potential new strategy to try and prevent some of the serious mental health impacts that we're seeing in the construction industry. So just giving a little bit of background, we know that the sleep and biological rhythms processes have evolved over millions of years. And as organisms, we've evolved to be day active largely, and we've evolved to have a consolidated bout of sleep overnight. Now, over the last few hundred years, we've sought to challenge those systems by implementing shift working rosters. Now, the construction industry is one of those industries that have this particular system in place. Now, we know that when we challenge the sleep system and the circadian system, which is the system that controls biological rhythms of physiology and behaviour, if we disrupt those systems, there are a whole range of flow-on effects. Some of these effects include an increased risk of cardiovascular disease, diabetes, obesity, and also a number of mental health effects. So some of these mental health effects that are common include depression, anxiety, stress, and burnout. Now, those mental health consequences are observed in a range of different shift working occupations, including increasingly in the construction industry. So what we have sought to do is to think about how to reduce those consequences by addressing upstream mechanisms. And those upstream mechanisms are to improve sleep and circadian rhythms in the shift working construction industry.
Thanks, Shantha. What can we learn from other industries? I mean, we're focusing here obviously on the civil construction industry and the broader building and construction industries, but what opportunities exist and what can we learn from other industries, particularly in tackling sleep management and sleep deprivation?
Well, John, fortunately, there are a number of lessons that we can apply to the construction industry from other shift working industries. We know that in the Australian population, as many as 16% of the workforce is actually engaged in some kind of shift work. We at the Turner Institute have worked with a range of industries, including first responders such as paramedics and firefighters and police. We've also worked with mining and oil and gas industries, and also increasingly in the healthcare sector and aviation sectors as well. All of these industries have shift work as a common practice within the workforce. And so we have been working with these industries to identify where the problems lie in terms of the links between shift work, the health consequences, and the increased risk of fatigue. And then we've been developing solutions to try and tackle these problems. So the first immediate consequence that we have to tackle is that disruption of the sleep and circadian systems results in impaired alertness. And the flow-on effect of that is fatigue and the increased risk of accidents and injuries. That's the immediate consequence. And that is, especially in safety-sensitive occupations, is a major risk that needs to be managed. Beyond that, there are long-term consequences in terms of health disruption and other flow-on effects. So we look at trying to prevent the mental health consequences as well as the other physiological consequences.
So, Shantha, given that experience and given that knowledge, can you touch on some, and rostering playing such an important role in terms of sleep deprivation and the impact that rostering is having, particularly in the construction industry. Can you touch on some of these tools that are being developed, and in particular an overview of some potential digital solutions and interventions that could be made that the Turner Institute is leading?
So John, about 10 years ago we embarked on a program of work to develop a comprehensive set of tools to try and reduce the impact of shift work and sleep disruption in occupational settings. Some of these tools, and these tools were developed through the Alertness CRC, which was a national consortium that brought together academic and industry groups. We developed tools that firstly detected and measured fatigue. We knew that Australia had leading technologies that allowed us to continuously measure and monitor fatigue, and particularly in real time in the occupational setting. And so we were able to improve the accuracy and the ability to get feedback from those sorts of devices. We also recognise that sleep disorders are highly prevalent in particular occupational groups. We know that they're prevalent in the community, but particular occupational groups may have a very high vulnerability to certain sleep disorders. So for example, in the police force, we know that up to 40% of police officers screen at risk for at least one of 5 major sleep disorders we have looked at. So we developed a digital system to be able to allow workforces to be able to have their employees screened for major sleep disorders and then provide referral to appropriate health professionals.
So Shantha, that really relates to shift work and how projects are actually delivered within the civil construction industry. So these tools could be used very proactively by businesses in bringing about better health outcomes for workers.
Absolutely, John. So we recognise that the tools that we have developed to manage shift work can really be effectively implemented in the construction industry. So some of these include rostering software. So we know that rostering software has developed over years to be able to manage the logistical constraints of particular projects. What we sought to do was to work with a particular software platform from a company called Opturian to partner with them to implement a fatigue algorithm into their software. The idea then would be that we would be able to roster the workforce in a more sleep or fatigue friendly way, so that the roster would now not only take into account the logistical constraints and demands of the project, but it would also manage the human element by reducing the impact of shift work and sleep disruption. We've already shown that implementing this kind of a rostering system in healthcare, for example, can substantially reduce the risk of errors and improve alertness and productivity in that workforce.
So, very simplistic way to the layman who might be listening to this today. Effectively, the algorithm means that based on the rostering, you're putting someone either in a high, medium, or low risk based on the level of rostering.
So we're doing that by allowing employers to be able to analyse their rosters and be able to classify them in the way you've described, as high risk and lower risk. But separately to that, we can proactively develop rosters that minimise those risks. For example, some of the factors that give rise to increased risk of fatigue and also the health consequences of shift work is the number of consecutive night shifts, for example. So we can analyse rosters, identify risk points in those rosters, and then intervene to develop better rosters that minimise those sorts of risks.
So we're embarking on a journey with Positive Plans, Positive Futures. We have a number of business leaders, businesses that are going to be part of that journey with us. Where would you like to see us in 3 to 5 years' time as part of the work that you're doing through the Turner Institute, and how can we support you on that journey?
Well, we'd like to bring together a consortium from within the construction industry. We think that this kind of implementation research is best done when it's driven by the industry need. And so the industry has already come to us identifying mental health as a significant industry problem. And so what we would like to do now is to comprehensively work with the construction industry, and I think CCF really will play a critical role in facilitating that interaction, bring together the consortium of stakeholders, further develop these tools and implement and test them in particular industry settings, in particular construction industry companies, and then we want to see these rolled out nationally as well. We want to make these sorts of tools available to every employer to try and reduce the overall toll of shift work on mental health.
And that's something that can be done right across the board in the different sectors, because it's not just about the big build projects which are currently underway by the state government. We've got the property developers, the land development sector. There are a number of sectors in which the civil construction industry are playing. And I would imagine you'd be able to get some really good research and data out of a pilot right across the spectrum to really understand where those potential rub points are.
Absolutely, John. It's really important that the tools that we developed are scalable and customisable. So what we want to be able to do is develop tools that can be implemented in large organisations, small organisations, in a variety of settings. So we want to develop a suite of tools that can be implemented in that way. One example is a simple mobile phone app that allows employers to be able to equip their employees with information on a daily basis about healthy sleep habits. So it's a tool that does both behavioural coaching as well as education. And this kind of a tool can be implemented in virtually every construction construction setting across the country.
Shantha, we're very excited at CCF about the support and partnering arrangement we have with the Turner Institute. I'd like to thank you for that continued support. I'm really excited about where we're heading with the Turner Institute and the tools and the opportunity to work closely with you and the team at the Turner Institute. And I'd like to thank you for your time.
Thank you, John. It's a pleasure to be working with you, and this is exactly what the Turner is committed to doing, is working with the industry to address significant community problems. Thank you.